We are having an increase in the numbers diagnosed. If you look at the data from 2010 to 2017, there has been a slight uptick in the percentage of people being diagnosed with ADHD, likely because the criteria has become more defined for the diagnosis of ADHD. There are 3 parts to that the patients have to meet in order to be diagnosed with ADHD. Basically, you have to have a hyperactivity component, an impulsivity component, and then an inattention to detail type of component. Our providers are becoming more comfortable with the criteria and just making the diagnosis more often. I also know that there is a slight trend in diagnosing ADHD in young adults and adults that we really had not seen previously. It's becoming, people are more aware of ADHD in the adult population. The brain development in a child through adolescence is quite variable, and sometimes we tend to think girls mature a little bit earlier, where the boys still kind of tend to be more robust or impulsive through that 8 through 14 or 15 time frame. And perhaps that's the reason why there's some increased diagnosis in those middle school years for boys. I think it really depends on the child or the patient who's been diagnosed with ADHD. Some people really are opposed to medications and don't want to take a medication that can affect the way the child is behaving and would prefer to go the psychotherapy route. But oftentimes the combination works really well. So I think it's really important to just have a conversation with your provider about the options that are available and the side effects, potential side effects for the patient who will be put on the medication for ADHD. Then looking at a behavioral health professional to help with that. But it is time consuming and it takes commitment because you have to work on those lessons that they talk about. The medication that is used is often a stimulant-based medication, and you would think that you wouldn't want to give a stimulant-based medication to a hyperactive young child, but it works differently in the brain of a patient with ADHD. And so that medication actually helps to calm the synapses in the brain, helps them focus and be more attentive. So it's really important as the child ages that the dosage and the time frames that the patient is on the medication is closely monitored, because these are also medications that can be abused. I think the best advice would be to talk with your healthcare provider about ADHD and the symptoms, and then also talk with your coach, your Sunday school teacher, other folks who have contact with your child to see if their behaviors are also showing themselves in their setting.